So toxicology is basically the study of poisons and their effects. And the sources of poisons are many, which include the plants, they include also the animals, and microorganisms such as bacteria, and even some viruses. They can all produce toxins, which brings about adverse effects to the humans and other living things. So those that come from plants, we talk about phytotoxins. These are phytotoxins that are derived from plants. Then the toxins or the poisons that are derived from animals are known as the zootoxins. Okay, you can get a zootoxin from an animal like a frog, from a snake, because they are coming from animals, so they are zoo toxin. Then we can have bacterial toxins. These are coming from microorganisms such as bacteria. Now, the specific poisonous chemical is what is known as a toxicant. So there are terminologies that we're going to find in toxicology, and specific poisonous chemicals are commonly known as toxicants in toxicology. Then there are certain substances that are man-made substances and or produced by, but not normally found in the human body. If they are not found in the human body, but they are man-made substances and they are poisonous in nature, they are known as xenobiotics. So you need to know some of these terminologies as you study toxicology. Now, the scientists have argued that actually toxicology is the oldest scientific discipline. That from time immemorial, people have understood the concept of poisons and toxins. And they have recognized that actually they come from plants, animals, and also just the natural environment from microorganisms. And there was need, therefore, for humans to know exactly which plant was toxic and which one was not. So most exposure of humans to chemicals is via naturally occurring compounds consumed from the food plants. So in terms of food plants, you've heard of people getting intoxicated from eating mushrooms. So you can see a picture of a mushroom there, but people of the old, early enough, they were able to differentiate or to distinguish the poisonous plants and non-poisonous, the poisonous mushroom, non-poisonous mushrooms. For instance, they would tell, if they see a mushroom and flies cannot sit on it, then they will suspect that this might be a poisonous plant. But if flies were able to sit on it, they would collect that type of mushroom, and to them it was edible and it was not poisonous. So people have used various techniques or knowledge of the plants to differentiate which one is a toxin and which one is not a toxin. So humans are exposed to chemicals both inadvertently and deliberately. So sometimes it can be by accident that you get exposed to a poisonous substance. Others is deliberate, where somebody maybe thinks of committing suicide, just using the poisonous substances that they know. So we know actually by now that 92% of all poisons happen at home. So this is what we need to guard against, because we should be very much at home. 92% poisonings include the cleaning agents that we use in our homes. They include fuels such as kerosene. They include medicines that you can put in, that you can get from the hospital and probably you have at home. Children may get exposed to them, and that can be a source of poisoning. And the other materials such as glue and cosmetics, they can all be poisonous to the humans. So certain animals, such as snakes, they can excrete xenobiotic poison called the venom, usually injected with a bite, or it can be a sting if it is coming from other insects. And other animals have infectious bacteria. They may be carrying the infectious bacteria that may result into. Beyond that, the poisons can also come from household plants. There are certain plants that you should be aware of at home that may be poisonous. Now, as I mentioned, from time immemorial, people have recognized that there are useful plants and there are poisonous plants. And if we go by history, by 2700 BC, the Chinese were able to document the poisons in their literature. And this is actually clear from the Chinese journals that they have, where they have documented the poisons from plants, the poisons from fish, and so on. And in 1900 to 1200 BC, the Egyptians also were able to document different types of poison, and probably even explain how those poisons were collected, prepared, and administered. So about more than actually 800 medicinal and poisonous recipes have been described. By 800 BC, in India, what is known as the Hindu medicine, they also noted a lot of poisons in there and antidotes. Antidotes are just chemicals that are used to neutralize the poisons. Then by 50 to 100 AD, the Greek physician, one of the Greek physicians actually classified over 600 plants and animals and mineral poison, which plants were poisonous and which ones were not poisonous at all. When you move again in time, around 50 to 400 AD, the Romans used poisons for executions and assassinations. So they understood how the poisons could work, and so they used them for execution of their enemies or people who were a nuisance to society, or for assassinating their enemies. The philosopher by the name of Socrates, others they call him Socrates, but Socrates was executed actually using hemlock. And this is because, so This as a philosopher, he influenced a lot of youths during his time. He was teaching radical ideas to the youths. And so the government was not happy with him. And they used a plan that in those times, it was a hemlock plan that they used to actually execute him. So you can see that poisons have been used. Poison. They had some remedies to provide so that they can neutralize the poisons. So the poisons really have been there for a long, long time. Of a man who is said to be the father of modern toxicology. And this man is Paracelsus, who lived between 1493 and 1541 AD. This man said that actually he redefined the understanding of toxicology. And because he was able to state that all substances are poisons. And he argued that there is, excuse me, there is none which is not a poison. It is just the right dose that differentiates a poison from a remedy. Mike Lawrence, do you believe that as a class representative? Because I may not ask everyone else. Do you agree
sorry.
to? Yes.
What's the statement again? The network was breaking.
Yes. Okay, the network was breaking. Mike Lawrence, I was saying that there is the father of modern toxicology, and this man argued and said that all substances are poisons. There is none which is not a poison. The right dose is what differentiates a poison and a remedy. Just on behalf of the class, do you think you agree with that statement?
Yes, I do.
Okay. You do agree in which sense?
I would pick of a practical instance of maybe a substance like paracetamol just. The right dose of paracetamol is able to produce a therapeutic effect and relief from pain. But but if somebody was to take excess paracetamol, like 12 tablets, I think that now becomes harmful. So such a substance can still be turned into a poison, whereas if used in the intended way, it can still work as a remedy.
Precisely.
Yeah.
Precisely. Okay. Thanks so much. So, like you rightly put it, the dose actually makes the poison. It is the dose itself that will make the poison. So, an apparently non-toxic chemical can be toxic at higher doses. So, as the saying goes, too much of a good thing can be bad. So, if you increase the more the doses, or if you escalate the dose, a substance which is potentially non-toxic or apparently non-toxic can become actually toxic. So highly toxic chemicals can be life saving actually. And this pharma students need to understand that even highly toxic chemicals can be life saving when given in appropriate doses. And this is why we always emphasize on the correct dose, that it should be the right dose. So poisons are not harmful at sufficiently low doses. And in toxicology, there are people who go into detail to look at how much of the substance actually, or how much of the exposure has occurred for the poisoning to take place. Again, in history, amongst the Spanish, there was a physician known as Ofila. So this is the guy who established toxicology as a distinct scientific discipline. For him, he said, wow, we've been studying toxicology in a way that is not well specified or distinguished. He decided to distinguish toxicology from any other type of science, pharmacological science. And he came up with toxicology as a distinct scientific discipline. By 20th century, there was a gentleman called Paul Ehrlich. Paul Ehrlich, for him, he used laboratory evidence to show how toxicants actually work. So he developed a staining procedure to observe cell and tissues, and pioneered the understanding of how toxicants influence living organisms. He did that through laboratory procedures, and he was able to demonstrate at cell level and tissue level how the poisons actually affects the living tissues. Then we need also to appreciate occupational and environmental toxicology. Now, this is very important. I'll give you an example of what is happening right here in Zambia, in Kabwe. We are actually mining lead and other minerals in Kabwe, but the after effects of bleaching in terms of consequences. So we find that in Kabwe, there have been reports that there's lead poisoning amongst the populations that stay near the mining area. You know, it's because of environmental pollution. So the lead, as they were mining, some of it escaped and remained in the soil, where people can come into contact with it, exposed to it, and it gets into the system and causes a lot of harmful effects. So from the environment, you can have what is known as environmental toxicants. And some of these environmental toxicants, you can get them by inhalation. If they're in the air, you can inhale them. Or if they're in water, if the water is polluted, then you can ingest them by drinking polluted water. So these substances can actually be very harmful to not only to humans, but as well as the then you can ingest them by drinking polluted water. So these substances can actually be very harmful to not only to humans, but as well as the environment itself. So environmental toxins are both, can exist as a natural substances, or they can be man-made substances. Okay, so public perception that man-made toxicants are more serious than natural ones, it's not true. On the ground, what has been shown according to research is that both are very, very serious. The naturally occurring toxicants in the environment as well as man-made, they are all, they are both poisonous. right? So workers actually typically exposed to a greater number of carcinogens for a long period of time, especially those that are working in industry. And some of the conditions that you'll be seeing in the clinical settings will be the cases of actually intoxication from poisonous substances. And they may be occupational related or from just the environment. So occupations with high risk of cancer include healthcare workers. For instance, people who are working in nuclear medicine, they get exposed to those rays. And so they can be at high risk of cancer, of having cancer. Then those that work in pharmaceutical companies, where you're using a lot of these chemicals, and especially if the protective equipment is not adequate enough and people are getting exposed, they can also be at higher risk of cancer. People working in laboratories, people working in refinery industries, people working as rubber workers, and furniture makers, or pesticide of some of these harmful microorganisms. They can also get exposed to those chemicals. They are at high risk of cancer. And because of that, there have been associations. Starting in 1961, there was a Society of Toxicology. So associations come together. Others by 1970s, we had Food and Drug Administration, for instance, in the US. The whole idea is to manage the toxins, to make sure that these toxins are properly managed and people are provided with safety measures so that they don't get exposed to the toxins. So because we have understood toxicology very well, we need to put up measures to prevent those that are at high risk. So there are certain terms that you need to be familiar with in terms of toxicology. When somebody talks about toxicity, basically they just mean the adverse effects that a chemical may produce. That's toxicity. Then in toxicology, when we talk about the dose relates to the amount to the human body. That's or to the body generally. That's the dose. Then exposure just means the contact providing an opportunity of obtaining a poisonous dose. So exposure is to come into contact with a poisonous substance. Then a hazard is a likelihood that the toxicity will be expressed, right? Then there are certain fundamental rules of toxicology that we need to appreciate. One of them is that for toxicity to be there, exposure must happen first. So exposure must first occur for the chemical to present a risk. Without exposure, then there will be no risk of poisoning. And this is the reason why in mitigation measures, we want as much as possible to remove the exposure so that there is no exposure. The other one, the other rule or fundamental rule is the magnitude of the risk is proportional to both the potency, which has to do with the dose of the chemical, and the extent of the exposure, meaning also the duration in which somebody is exposed to that chemical. So the dose makes the poison actually. So that is very important concept to understand. It means the toxicity. So somebody can be exposed, but if the chemical is unable to reach the target site, then the exposure may not be expressed as it were. Then in terms of exposure concepts, different toxic responses may arise from different routes of administration, for instance, also the frequencies of exposure and the duration of exposure. And the duration, we talk about whether the exposure is acute or it's chronic exposure. So in terms of route of environmental exposure, one can be exposed through ingestion of a poison. And this could be through contaminated water or contaminated food. The other route is absorption through the skin. Once somebody is exposed to the substance, it can actually penetrate the skin and they get exposed. The other one is by injection. Either somebody injects you a poison, or there's a bite, or there's a puncture of some kind, or there's a cut in the skin that can also expose somebody to a poison. Then also by inhalation. So if somebody is able to breathe in poisonous substances, then they will get exposed from the environment. Then in terms of chemicals, we always say that there are chemicals everywhere. And this is quite difficult to avoid, but we are aware that chemicals are everywhere in our environment. And everything in the environment is made up of chemicals. That much we are aware. So both naturally occurring and synthetic substances are chemical in nature. So people are exposed to chemicals by either eating, swallowing them, breathing them through the air, absorption through the skin or the mucosa surfaces. People can protect themselves by blocking these routes of exposure. And that's very important. This is why we are looking at the fundamental concepts about poisoning. Some of the fundamental rules is about, we need to talk about exposure. So if you can block the route of exposure, then you will have provided a mitigating measure for further exposure to the vulnerable person. Then, in terms of duration and frequency of exposure, components of exposure and contributes to a dose. So, in terms of duration, the longer you are in contact with the toxicant, the more you're going to absorb it, you're going to get it. And also frequency. How many times have you been exposed to that substance or poison? So that will determine, because there will be a cumulative effects, and that will result into an increased dose. And that is the dose that will be harmful. Definition of exposure is what is known as acute exposure. Acute exposure is something that was less than a day. If you've been exposed. If we give an example of smoking, if there's somebody you visit a place where they smoke, if you are there for the whole day, for 24 hours, and you have inhaled the smoke, for instance, from that cigarette, it means that you have been acutely exposed if it was within 24 hours. But if there is repeated exposure, where you are there, probably you are getting exposed for up to 30 days. For a month, we call that subacute exposure. If somebody has been exposed for more than a month to 3 months, or 90 days if you like, that is subchronic. Then somebody who's exposed for more than 3 months or 90 days, if it is in days, that is chronic exposure. So somebody will be chronically exposed, and this will determine on how you handle actually the poisoning that has taken place, and also how much of the dose they may have in their system, depending on the type of the substance they were exposed to. So in terms of the exposure concepts, the exposure to chemicals may come from many sources. Like we have emphasized from the environment, from the occupation that you do, from the treatment, from the food that you eat, that's dietary, and it can inadvertently occur, like in an accident or deliberately, where somebody just poisons him or herself. So all those could be the sources of poisons. So what I'm projecting there is a graph. This graph is about children and poison. Children who have been exposed to poisons. So you see that on this graph, there is, and this age is in years, and then we have for the percentage of, so the percentage of the poisoning, of all the poisoning. So you see on the x-axis, the age in years. So I would ask, is there anyone who can like try to tell me which age group is more at risk of being exposed to poisons according to this graph? So can I pick on someone? I'm seeing here. So Peter Malupenga, are you able to hear me? You can unmute yourself. Yes, Peter Malupenga. Yes, yes. What can you say about this graph? Whatever you think of when you look at, when you analyze this graph in terms of children and poison, what can you say?
Okay, according to this graph. Okay, according to this graph, the age which is at high risk is 1 year. Then seconded by the one in 2 years.
That's right. Yeah. Okay. Yeah, that's good. So anyone else? Is it Charlie Mopeta or Charles Mpeta? Can you say something? Can you unmute yourself?
Okay.
Yes. What do you think? What do you think? Maybe children who are 1, 2, 3, 4-year-olds are more exposed to poison than younger children or older children.
Okay. So, wow. Basically, I think this is because older children, mostly these are easier to control. And mostly when you give them instructions whereby they can stay away from certain things, when you tell them to say, okay, this is not supposed to be consumed, this is not supposed to be taken, they can easily understand. But when a child is in the range of 1 to 2, they literally know nothing. Anything they see, they would maybe either try to put on their mouth, they might try to think it's edible. In short, they cannot differentiate from what's right and what's bad. I think that's my take.
Right. You know, that's correct, Peter. because children are still developing. For instance, maybe their senses are not fully developed, for instance, so they can take even kerosene, even when it's smelling, it has got that bad smell. They can still drink it because their sense of smell is not fully developed. So they are more at risk. And also, like you've mentioned, they cannot easily follow instructions from either the parents or any guardian. So they will get more exposed. Yeah, so you can see that actually it's been shown that children are at more risk the elderly people to get exposed to these toxicants. Then what we need to understand also that there is individual response to these type of poisonings. People respond to the intoxicants differently, and there are so many reasons why this happens. One of them, anyone to think of why to chemicals that they're exposed to? Can I pick someone I'm seeing here? Derek Kumwenda. Can you say something? Derek Kumwenda, are you able to unmute yourself? Okay. So, Devson, you can unmute yourself.
Yes, sir.
Oh,
Maybe just
yes,
pardon.
yes,
What's
Devson.
the question?
The question, Devson, is that why is it that people actually respond differently to the effects of poisoning?
Why we react differently to the effects of
why
poison?
we react different? Yes.
All right. I think here issues to do with genetics also comes in, based on the genetic makeup of an individual. Can also to some extent determine how an individual can react to these poisons. Yes.
Yeah. You're right. Thanks for that response. So the variety actually of responses.
Hello.
Hello, you wanted to add something?
Hello. Hello.
Yes, I think I got you right. Hello, I got you right. You can mute yourself now.
No, it's okay. It's all right.
Yeah,
yes, sir.
That's fine. Okay. Right. Thank you so much for that response. Yeah, so it's true
All
that,
right.
yeah, because we are genetically different. So chances are that we are going to respond differently to different type of poisons. And there are people who are more susceptible than others. So it's the dose and the individual susceptibility that plays a role in all situations involving chemicals. So you can all, for instance, be exposed to the same poison, but others will experience more adverse effects than others because of other issues. Some people, it could be issues of genetics. Others, it could be maybe socioeconomic issues that maybe they are well nourished, such that the poison can easily be neutralized in their system. Or others, it could be that they take more of water, which can wash away the poison. Others may not be so much of good at drinking water, so that they wash out the chemicals from their system. So there's that individual variation to poisoning. And this is why members of the same family will be exposed to the same chemical, but they will all react differently. So these poisons actually, if you recall what we mentioned earlier on, xenobiotics, meaning these are substances that can be actually synthesized within the body, but they are foreign substances within the body. They are strange, if you like. And these xenobiotics may be naturally occurring or chemicals produced by plants, microorganisms, or animals, including humans themselves. So xenobiotics actually can pose a danger to humans and may also be synthetic chemicals produced by humans themselves. So poisons naturally are xenobiotics, but not all xenobiotics are poisons, meaning that it's not all poisons that are made in the human body and they are foreign to the human body. Okay, but some of them are. So how does the body prevent the action of xenobiotics or get rid of poisons from the body? It's things that you already know. One of them is once the body is absorbed, once the poison is either ingested or absorbed into the human system, once it gets into the extracellular fluid, which is in the blood, it can be redistributed to other parts of the body. And that way, it reduces because it's been redistributed. Once it's distributed, it goes to other organs where it can actually be excreted. So excretion helps to prevent the action of xenobiotics, especially those that are water-soluble compounds. They can be eliminated through the kidney after they have been metabolized probably in the liver. So metabolism is the major mechanism for terminating xenobiotic activity or action, and is frequently the single most important determinant of the duration and intensity of the toxic responses to the xenobiotic. So in terms of metabolism, the main one to help us to eliminate the poison from the system is the liver, the poison. Then the GIT, through bowel movements, you can excrete, you can actually remove the poison from the system. And other routes that could be there through sweating and others. But the main one is the liver plays a very important role in eliminating the action or terminating the action of the poison. So redistribution and excretion are very, very important and are highly dependent on the metabolism that is going to take place. So if you look at this scheme here, the diagram, just to show you on what's really happened, how that you are going to have a xenobiotic here, which will cause, which a person will be exposed to, and there will be exposure here. Once that person, an individual is exposed, the xenobiotic, eventually, whether it's by absorption, whether it's ingestion, and other means, it will get into the plasma. So it will get into the blood. And that is what is going to constitute a dose in there. When it's there, it can be stored in the tissue, either in the fat or in the bone or in plasma proteins. That chemical, that xenobiotic can be stored in there. The stored tissue, it can be mobilized back into the plasma. And when it is in the plasma, so it can interact with certain receptors or certain enzymes in the system. And through that mode of action or mechanism of action, cause certain undesired effects. And it can also demobilized back into the bloodstream. Some of the chemical or the xenobiotic may go to organs like the liver, where it is going to be metabolized. Okay, some of it will remain in a state where it's not have been metabolized and get back into the bloodstream. Some of it may go to organs like the kidney, where it will be excreted, or the skin, and then it will be excreted from the body. So that's how it all works in terms of toxicokinetics, meaning how the toxin, the toxic substance actually moves. Toxicokinetics is about the movement of the toxic substance. So that's how it moves in the body. Then this general scheme of xenobiotic metabolism. So usually the lipophilic substances can get into the liver, where metabolism takes place. And once metabolism has taken place, this decreases the biochemical activity of a substance, or increases the excretability of the substance. And usually these are metabolites which come out as hydrophilic substances. So there are phases in this process. So we have the phase 1, where there is oxidative process. And the oxidative process will involve bioactivation of the substance and detoxification of the substance. Then we have, after there's bioactivation and detoxification, metabolites are formed. And these metabolites, once they are formed, they go into phase 2, where there could be detoxification under phase 2 happening. And once the detoxification has happened, again, these new metabolites, because of the synthetic processes that are taking place, you find that there will be issue of the size of the xenobiotic, whether it's ionized, whether it's water soluble, increased stability, so it will be eliminated accordingly. So that's how these xenobiotics are excreted or metabolized and excreted finally from the body. So the question is that how do xenobiotics cause toxicity? Some xenobiotics cause toxicity by disrupting normal cell function. So there's an order of activity on how the cells work in the body. So the xenobiotics disrupt that normal function. And they do this by, 1, binding and damaging certain body parts, for instance, that are protein mentioned, that can be damaged. Then the other mode, how they cause toxicity, is that they bind and damage the ribonucleic acid, DNA. And this is where the issues of mutation takes place, because you have changed the genetic material from its original state to a different state. So that is also a possible way on how the xenobiotics actually cause the toxicity, by damaging the genetic material, the DNA. The other one is actually also binding and damaging the lipids in the body. So the lipid bilayer, probably its integrity may be disturbed, because the xenobiotics has actually attached to a lipid and has caused damage to it. And then also react in the cell with oxygen to form free radicals. So the chemical can, through oxidative reactions, may react with oxygen in the cell and form the free radicals that can damage the lipids, the proteins, and the DNA. So in that way, maybe substances that can remove the free radicals from the system so that you reduce on the damage of the toxicants in the system. So there are various types of toxic effects. Some of the effects that you see actually is actually death. Somebody may die because they have taken a poisonous substance. And some of the very potent poisonous substances that we know that can easily cause death include arsenic compounds. They include cyanide. Very, very toxic. They can kill within a very, very short period of time. Others, they damage the organs in the body, like ozone or lead, the one I mentioned. Lead can damage, for instance, the central nervous system in the body, can damage that organ. And so certain substances, they work by way of damaging the organs in the body. Others, they can cause cancer. They are carcinogenic. You know, substances like benzene, asbestos, they are cancerous in nature. So those are some of the effects that you see. Others are teratogenic. I'm sure time and again you've heard of the thalidomide story. So this is a drug. This is a drug which is being used now for different therapeutic options in clinical setting. So this drug was used at one time in pregnant women to treat nausea and morning sickness, if you like, for pregnant women. So women, it was considered to be a wonder drug. Women took it, but at some point it was realized that actually it caused teratogenic effects in these women. So meaning babies who were born with deformed limbs. And so it was removed from the market. But after some time, scientists have been working on this drug. So they realized if this drug could prevent multiplication of the cells, why can't we design in such a way that it prevents the multiplication of cancer cells? So if you go to cancer disease hospital today, you're going to find this drug being used, thalidomide, and it's there on the market. But it's teratogenic. So the precautions that it should not be used in pregnant women, as well as women of childbearing age. It should not be used in those populations. Then these toxins actually, they can really damage organs. Some of the organs that are involved, like I mentioned earlier, central nervous system. Lead can damage the central nervous system to an extent where it can reduce actually the cognitive function in children, meaning the learning abilities can be compromised because of the damage of the central nervous system. Other chemicals, they can affect the immune system. The isocyanates do that. Others, they can damage the liver. And we'll talk about this more in subsequent lectures, where we'll talk about the effect of on the liver, or alcohol, or beer, if you like. on the liver, like acetaminophen, paracetamol, if you like. McLaurence actually alluded to this that a drug like paracetamol. So paracetamol can cause damage to the liver. As I get this drug, and these include tobacco smoke, asbestos, and ozone. Then others, they can damage the eye, such as UV light, exposed to too much UV light, and heavy all right. Then we have those that can actually affect the reproductive system. The dibromochloropropen are some of the substances actually that can affect the reproductive organ in humans. Then we can also in toxicology actually talk about mechanistic toxicology. So in mechanistic toxicology, the question is, how do chemicals cause their toxic effects?
Doc, if you could continue to share your screen, we can no longer see.
Oh, the screen is, you're unable to see the screen now. Okay, so you can pause a bit. Let me share the screen. I thought that it was.
Okay.
Okay. Are you able to see it now? No.
Not
No,
yet.
no.
Okay. Are you able to see it now?
Yes, we can.
Yes, we are.
Oh, good. Yeah. So we are now talking about mechanistic toxicology, and mechanistic toxicology has to do with how actually chemicals cause their toxic effects. So the question is that what do actually toxicologists do? Okay. So most toxicologists actually work to develop a mechanistic understanding of how chemicals, of the things that they do is to develop safer chemicals, chemical products. That's one of the things. For those of you that will specialize in toxicology. By the way, like I mentioned, probably I would have mentioned this before to you, we have one of our former students from Ridgeway campus who went to Sweden to go and start toxicology. And he just recently defended his dissertation. He just completed his course in toxicology. So one of the things he could have learned if he did probably mechanistic toxicology is to develop safer chemical products. Also to develop safer drugs or medicines, if you like. Also to determine risk for chemical exposures. These are people who are been trained on how to determine the risk for exposures and also develop treatments for chemical exposures. For instance, if somebody has been exposed to a chemical, what is the antidote? What's the treatment? What measures should be put in place to mitigate the effects of the chemical? And other things that they do is to teach toxicologists. They teach, for instance, they teach graduates, undergraduate students or graduate students about these chemicals. So mechanistic toxicologists actually study how a chemical causes toxic effects by investigating its absorption, its distribution in the body, and its excretion. And this sounds like pharmacokinetics. So it's toxicokinetics. So in short, they will study toxicokinetics. They often work in academic settings or private industries and develop antidotes, substances that neutralize the poisons. So these are mechanisms. The scope toxicologists is fine. Others are not deceived toxicologists.
Ananias, you're the new host. Continue teaching.
So there should have been a disruption there due to the internet. But are you able to see the slides?
No.
No, we're not.
You are unable to see the slides. Okay, let me just bring back the slides. Are you able to see the slides now?
They are loading.
Yes, sir.
Yes, sir.
Yeah, they are showing now.
Oh. You're able to see the slides? Oh, good. Good. Yeah. So I was talking about actually the scope of toxicologists that we have. I think I described what mechanistic toxicologist is and what they do. And now I was talking about descriptive toxicology, and I was saying that even a pharmacist can become a toxicologist. And when you become a toxicologist, for instance, you can work even with food and drug, where you're going to be evaluating or analyzing drugs and foods and other products. So they develop, still admitting some people, I don't know, they're joining 30 minutes, a few minutes before we are ending the lecture, but I'm trying to admit them here. Yeah, so they often perform experiments in a pharmaceutical or academic setting just to evaluate or analyze the amount of toxic substances, either in drugs or in food. And for those of you who are in fourth year and you're thinking about your research topic, you can even begin to start thinking around toxicology. Because probably at your master's level, you'd want to do toxicology because it's within the pharmacy domain. So what you can do is that, for instance, you can start thinking of, okay, in certain foodstuffs, the amount of poisonous chemicals, or is it heavy metals or whatever? How can you go about analyzing and ascertaining the content or the products? Others, it will be even in drugs, for instance. How much of the heavy metals are in the drugs that people are taking? Especially some of the drugs that are produced from countries where you think the standards may not be up to date or may not meet certain parameters. And begin to work towards something that you think will be that line. So we have also what are known as the clinical toxicologists. Now, clinical toxicologists usually are physicians or veterinary doctors who are interested in the prevention, diagnosis, and treatment of poisoning cases. They have specialized training in medicine, and poison management. So some time back, because we never had a clinical pharmacist, and so it was restricted mostly to physicians or doctors and veterinary doctors. But now even pharmacists who are clinical pharmacists, because this is clinical work. So even about prevention, diagnosis, and treatment of poison cases, and you specialize in that field. Then we have what are known as forensic toxicologists. These, they study the application of toxicology to law. Okay, they use chemical analysis to determine the cause and circumstances of death in a post-mortem investigation. For instance, the pathologist. So you can have a general pathologist, but you can have a pathologist who is specialized in toxicology. And for them, any case that is being suspected of poisoning, they can take it up and do a post-mortem investigation and come up what could have been the possible cause of death. So these are toxicologists. These, they study the effects of pollutants or organisms or populations or ecosystems and their biosphere. So they are more of as the term is self-explanatory, looking at the effects of poisons in the environment. They will start them. Then we have regulatory toxicologists. These use scientific to protect humans and animals from excessive risk. Okay, so we have, like in Zambia, the ZAMRA, which is a Zambian authority. So you can be working at ZAM by a regulatory toxicologist, and you need people, especially farmers, to specialize in this field. So in terms of regulatory toxicology, descriptive and mechanistic toxicology to perform risk assessments. Okay. Okay, are you able to hear me?
Yes, sir.
Yes, I think, again, we had the challenge with the internet. So are you able to see the screen?
No.
No. No, sir.
But we're able to
Okay, let
see.
me put the screen back. Will be done in the next few minutes. Be done in the next few minutes. Yeah. So I was talking about the scope of toxicology that is quite wide, and as pharmacists, we have a chance to specialize in any one of those domains of toxicology. And so what we've actually talked about is toxicology in general, just to give highlights of what toxicology is. And here, in a summary or in review, we are saying that toxicology is the science that studies the harmful effects of overexposure to drugs as it relates to us as pharmacists. Also, the environmental contaminants and naturally occurring substances found in food, water, air, and soil. So the main objectives are to establish safe doses and determine the mechanisms of biological actions of chemical substances. Those are the main objectives of toxicology. And we have also said that you can develop actually a career. Now you are a pharmacist, you may be interested in toxicology. And there is a career in toxicology. And this career involves evaluating the harmful effects and mechanisms of actions of chemicals in people. You may not only evaluate these in humans, but you can go to other animals and or other living things in the environment. So here, the thing is that you want to carry out some work that can contribute either to government or private or just industry or consulting firms where you provide your expertise, whether it's in an academic environment like in the universities, about people, so that you can provide the knowledge about the toxicology of your environment. So you can be in academia and then provide that information. Then we've also talked about toxicologists as they routinely use many sophisticated tools to determine how chemicals are harmful. So toxicologists can use computer simulations, they can use computer chips, they can use molecular biology, they can use cultured cells or genetically engineered laboratory animals just to determine, because you cannot be experimenting in human beings, but you can experiment in animals to see the toxic effects of the substances. So what is at risk? What is the risk here? So people can make certain choices or some choices about chemical exposure. For instance, if you work in nuclear medicine, choices can be made where people can, the limit of exposure or the extent of exposure can be limited by making sure that people are not in such environments all the time, but that they can take breaks so that the exposure is not too much. However, we know that you can make decisions about the exposure, but however, some exposure is controlled at a level other than an individual one, where you say, okay, today I don't want to be exposed. So collective groups of people, such as communities, the government, they seek to control chemical exposure at a community or global level. And this is through actually to control through certain organizations that can be formed, or societies, if you like, or certain government agencies that can put in measures to control the risk of exposure. So in terms of understanding toxicology, it's one discipline that is very difficult. For instance, if you wanted to do a research to find out whether a certain plant or a certain chemical that is known is toxic, so you, because of ethical issues, you cannot do that experiment in humans. But animals are readily available, which you can use in research to come up with scientific evidence that a particular substance is harmful to the systems or to the organs of animals by subjecting those animals to such chemicals, and then follow the toxicokinetics in the system, and then come up with evidence that this substance really is poisonous, and it affects a particular organ that you may want to analyze. So virtually every medical achievement of the last century has depended directly or indirectly on the research in animals, in as far as toxicology is concerned. So you should be able to know that you cannot do studies in humans, but mostly in animals. So in summary, as we end this lecture, what we are saying is that toxicology actually is a very fascinating science that makes biology and chemistry interesting and relevant. So some of you would want to go into this career. It's one that you can take up and see how you can advance yourself in toxicology. So understanding the how, which is the mechanism of action, something produces a toxic effect can lead to a new way of preventing or treating chemical related diseases. So animal use in research is essential for medical progress. So if you want to really understand the mechanisms, you cannot use humans, but you can use animals to understand how these toxicants really affect the human body. So many diseases are the result of actually interaction between genetics, something that we mentioned earlier, and the chemicals in our body. So the individual variability in terms of genetics actually is very important, or in terms of the effects that you get after somebody has been exposed to the poison. Toxicology provides also an interesting and exciting way to apply science to important problems of social, environmental, and public health significance. So toxicology is very, very important, and in our setting, we don't have much toxicologists, and this is why I would like people to understand more about toxicology so that we can see how we can increase the number of toxicologists in our setting. Some people come with disease conditions not knowing that actually it's because of continuous exposure to the environment that makes them sick. But if we have people who understand better toxicology, they'll be able to advise to say that it's better to remove the exposure from the patient, and then patients will get better. Because there are people who are like, they come to the hospital with a disease, they are treated, they get better, they go back home, they go back to the same exposure and get sick and then come back. And that cycle actually continues, or because people are lacking the understanding of toxicology. So we need specialists in that way. So the question is that what is your role as somebody who understands toxicology or who's been introduced to toxicology? So we should understand that risk is a part of everyday life. That is very important. And one's decision as to the acceptability of a particular risk is influenced by knowledge and experience. There are people who may not be knowledgeable enough, and it means that they'll be more vulnerable to toxins because they don't understand and they don't have any experience. So if you understand, and then there will be a time where you can make a decision and correct the situation. So while we cannot do much about the experience part, we can try to increase the public's knowledge about the risks and benefits of all chemicals. So since we understand the chemicals, we can share that knowledge to the public. And that's our role as people who understand. We don't need to be a toxicologist, but if you understand toxicology, then our role will be that of sharing the information so that people are not getting exposed to the chemicals that can harm their body. You must play a critical role in this effort. We expect everyone else who is studying toxicology to play a very critical role, and we can do it we can't do it without everyone's involvement. So you and everyone else who at least understand toxicology, we should be able to work together and prevent the risks of exposure or minimize the risks of exposure so that people are not getting exposed to the chemicals that can harm their bodies. So for now, this is what we had in terms of introduction to toxicology, just to give you an idea what toxicology, the scope of toxicology, what it's all about, about the principles of management of poisoning. So we'll talk about how actually poisoning is managed. So do I have any questions from you guys on the other end? Anyone with a question?